This was a phase 1 study looking at the safety of actually 2 immune checkpoint inhibitors that we combined in a metastatic renal cell carcinoma patient population. We studied 2 concurrent dosing cohorts of nivolumab and ipilimumab, 2 different dose levels. One arm had nivolumab 1 milligram per kg and ipilimumab 3 milligram per kg, and vice versa. The primary endpoint really was safety by AEs and laboratory values, and then secondary endpoints for efficacy. We gave up to 4 concurrent dosing, 3 weeks apart, up to 4 doses. And then patients actually had the chance to go on to maintenance therapy with nivolumab, single agent. We enrolled 21 and 23 patients respectively per arm, and we looked at AEs. Grade 3-4 AEs were 30% in one arm and roughly 70% in the other arm. Overall, side effects were manageable, but the use of steroids was required 30% of patients on one arm and 70% of the patients in the other arm. The toxicity was really driven by ipilimumab, classic GI toxicities such as diarrhea, colitis, as well as inflammation of the liver, hepatitis. Again, these were typically well manageable with steroids. The encouraging finding was really the clinical activity. So we saw an objective response rate of 43 and 48%, which really exceeds, I would say, the single agent nivolumab monotherapy experience, which is probably around 20%. This is kind of like mirroring the experience in the melanoma world, where we have now seen with longer follow-up for similar treatment schedules an unprecedented survival benefit. The data from this phase 1 trial really instructed the design of a phase 3 trial that is actually now starting to accrue. This is a trial that randomizes patients to either nivolumab-ipilimumab combination versus sunitinib. This is a large phase 3 international trial accruing up to 1,000 patients with sites in the United States, South America, and Europe. Very experienced sites in the United States. They should be visible on the clinicaltrials.org website, but clearly a major presence in the United States and then South America and Europe.